in his speech during the opening of the executive board meeting of the Africa CDC. He glossed over it, but I think I would like a comment from you. You mentioned that Rwanda has already submitted documentation for its eradication of hepatitis B and C, while Egypt is also on its way towards eradicating these two diseases. So I would like to know, I would like a comment from you, and what do you think this trend from these two countries mean for the eradication of hepatitis in Africa, and the prioritization that African countries that also want to eradicate these diseases should focus on? Thank you very much.
Thank you, Paul. I think let's just be sure that we understand that our vaccination programs started very late on the continent. So collecting appropriate data from across the country that is representative will take time, for sure. There are two countries that are vaccinating very quickly, like Morocco and South Africa, that will potentially offer us a source of that kind of information so that we can have the depth and breadth of information to analyze and come up with the appropriate conclusions. But for now, I think it is my view is that it's still very early to pull data and make a comprehensive analysis of what who has received a vaccine, which comorbidities they had, and if they influence the response. What we are seeing overall, and this is based on data from South Africa, Paul, is that for the Johnson & Johnson vaccine, it provides an effectiveness up to about 5 months to 6 months. I think that is very good. We also have seen data from South Africa that with a booster shot, booster meaning that, remember, Johnson & Johnson is one shot, that if you take the second shot, it actually provides effectiveness, sufficient effectiveness against the Omicron. So that is all very good. And this is all data that is about to be published or is probably now published. I've seen the preprints of that data there. So based on it, we also know that the RNA vaccines decayed about 4 months to 5 months later. So somehow it would suggest that around the time period of the 5-month mark, it is appropriate to think of taking your second shot. So that, I mean, call it a booster meaning the third dose, or a second dose, that would be the case for Johnson & Johnson. That average time period seems to be working well for those categories of vaccines. For the inactivated vaccines, we know that they do not really do well in the face of the Omicron. But we also know that if boosted with a non-activated vaccine, then they provide sufficient immune response. So then that can also be an algorithm to look at. But for the comorbidity piece, early days, in my views, to actually pick a country other than South Africa, Morocco, and maybe Seychelles and Mauritius that have a scale of vaccinations very early on, it will be very difficult to have that kind of information for now, but it will come. In terms of the eradication, congratulations to both countries. That is what we believe in. We hope that other countries will learn from that. We also hope that it will become a teaching platform on how to do that. Once those countries that you indicated have submitted their report and they are clearly certified that they have eliminated the disease. I don't know if they use the word elimination or eradication, but at any rate, it is a very positive outcome that must be recognized, and actually congratulate those countries for the advancement. Egypt has been a leader in the hepatitis work for long. They produce drugs against hepatitis C. The president, CDC, has been very strong on pushing the hepatitis agenda. So I think I'm not surprised that they're achieving that level of success so far.
All right, thank you. Hello to Rhoda Odhiambo, who is with the BBC. Rhoda says, has any African country reported the sub-variant of Omicron that is named stealth Omicron? And if yes, which countries are these? That's the first part. The second part, in terms of sequencing, do African countries have the capacity to detect this substrain? She adds that UK scientists say that this variant lacks a feature that allows probable cases to be distinguished among positive PCR tests. Finally, she asks, should we be worried?
I think the answer to that question clearly is that we just don't have that information yet across the continent. And it's not because we don't have the capacity. We have a very strong network of what we call in the Africa CDC pathogen genomic network that has allowed us to function collectively as a continent. And that network is full of very capable labs across the network, including specialized labs in South Africa, in Nigeria, in Senegal, regional labs in Morocco. And again, it's an impressive network. So, and they are extremely experienced now in this, the ability to sequence and detect variants. So we will be looking at the database very carefully. And again, let's just remind ourselves that it's not because a variant is reported that that variant occurred at that time point. I mean, Omicron will be a good example where we all talked about Omicron from South Africa, but we also know that data from other countries suggests that, including the Netherlands and the United States, that the variant was there even before the South Africans reported it. So detecting a variant doesn't mean that that variant started from that country. And it could have been in the database. So the first order of business is always to go back to the existing database, analyze it, and see if that variant has already been in the mix for a while. So the second part of the question with respect to will the variant be picked up? I mean, let's cross that bridge when we get there. We don't be speculative at this point. Let's see what, if first of all, the variant is available, and also learn from those who have picked the variant in the UK to see the laboratory data if the variants are being missed by the standard test.
Thank you, John. We have 5 or 6 questions that are coming through as secondary questions that have been asked by colleagues, and I will put those forward to you. But colleagues who want to ask new questions, please go ahead and do so, and we'll give you priority if it is your first time around. So on to the follow-up questions. The first one is from Sarah Jerving, who is with DEVEX. She says, what sort of decisions on the African Medicines Agency do you expect to be made during the African Union meetings in the coming weeks?
I don't think that, as far as I know, there are any decisions that will be made. I think the African Medicine Agency has now been officially launched through a treaty. The task ahead is to get it operationalized, which is to have it hosted somewhere, recruit the staff, and start making it do what it's supposed to do. I don't think the head of states or the executive council or foreign ministers will be issuing additional decisions there. The AMA, as is known, is a very welcome initiative. It will complement the work of Africa CDC tremendously. I think it's all part of the Agenda 63. If you look carefully into that agenda, it talks about developing institutions. And the African Union has already set up the Africa CDC, is now setting up the African Medicine Agency. So I don't think there's a decision that will be made in the coming days. But I might not be privileged to the details of that because the AMA, as is known, is not part of Africa CDC. It could be that it's very possible that some other discussions are happening that I'm not privileged to.
All right, thank you. The second question that we have coming through from Agostino Leita, who is with Lusa News Agency in Lisbon. He says, Africa CDC said 2 weeks ago that Guinea-Bissau was one of 7 or 8 countries experiencing the 5th wave of COVID-19. But the Guinean authorities say it is the 4th. Is Dr. John in a position to clarify on this?
I'm not, if we have had this question earlier, we probably would look more into our data and compare that with what, and do the analysis, compare that with what the Guinea is reporting. I think let it be known that Africa CDC doesn't Africa CDC rely on countries to provide the data. Okay, that is reporting data from countries. We do not create our own data sets. Okay, that is the whole principle behind how we operate. So I'll leave it at that. That if there's a fourth wave or fifth wave, it might be marginal difference that we are referring to.
Okay, thank you. Ronald Muite has come through with a follow-up question, and Ronald is with the China Radio International. He says, how many doses of the Chinese Sinovac has Africa received so far? And what are the expectations of working together in the year ahead, including the setting up of local vaccine production and expanding the capacity of the Africa CDC?
I really don't know the exact number of doses that have been received across the continent. I can only refer to the announcement that was made recently during the China-Africa meeting, I think a few months ago, with respect to 1 billion doses that will be made available. So that, I mean, I don't know the specifics of that. Now, vaccines that come to us on the continent through the African Vaccine Acquisition Task Team are under our control, which means we know the details of those vaccines. But if vaccines do not come through that mechanism and they go directly to the individual countries, it's very difficult to track where those vaccines are. As I said earlier, there is a broad understanding that we need all partnerships on the continent, for sure. I mean, it's just, again, needless to repeat myself, that including partnership with China, including partnership with the United States, Europe, and all the parties that are involved. As a matter of fact, in February, there will be a summit, the EU summit in Brussels, and the health issue will be discussed, just to show you the extensive portfolio of partnerships that the African Union and Africa CDC have with our friends.
All right. The secondary question from Mohamoti Mahome is there any estimation of when the vaccine manufacturing facilities that have been launched in South Africa will start positively impacting the distribution of COVID-19 vaccines in Africa? And can you update on how many vaccine doses have been received from them so far, and how many are expected before the end of 2022?
So we don't know with precision when the vaccines will start from South Africa, will start hitting the arms yet. But we know for sure that those doses, the 37 million doses from Harvard, the Johnson & Johnson vaccines are coming from South Africa. They are coming from the Aspen manufacturing site in Port Elizabeth. So at least we know that for sure. I was there personally to see what was going on, and we are very, very encouraged with that.
Thank you. James Macharia Chege with Reuters says, Dr. Nkenga Song, do you have any new information on whether Eritrea has started giving vaccines to its people?
No, I don't have that information.
All right, thank you. That clears our inbox for now, but I suppose colleagues may still be typing out some of their questions. So perhaps in the meantime, could you advise us if we are at any risk of further infections coming through from animals? Because we've been hearing reports of zoo animals contracting COVID-19.
Yeah, this is a virus that, as I said earlier, and I'm sure we're repeating myself, this is a virus that we continue to learn every day. And every other month that goes by, we learn more. We learn more in terms of which other animal or is out there that has been infected. We learn more, but we just don't know yet if I've not seen reports that show that viruses are being transmitted from animals to humans with this COVID infection. We know for sure that zoonosis, as it is called, is the ability for viruses to skip from animals to human. But I don't know if for the COVID-19 virus that animals that are infected do transmit it back to humans. So again, only research will tell us if that is the case. But the spectrum what is amazing is that the whole spectrum for this virus is so vast. Okay, we heard early on in the pandemic the main farms in Holland that were infected, that had many infections of the COVID virus, and now other animals, the species. But we don't know if cross species is happening within the context of this particular virus.
All right, thank you very much, John. We have Sarah Jerving who has her hand up. Sarah, please go ahead. Hello, Sarah.
Sorry about that. Thank you. Moderna's Shannon Klinger said last week that the African Union declined to exercise its purchase options for 60 million doses. Is that correct? And why did the African Union not exercise this option? Thank you.
Well, that is again, Sarah, is based on the pool procurement. Remember what we do at the African Union is that we do not buy vaccines and then sell it to countries. So what we do is that when we identify where vaccines are, and then we reach out to countries and say, here, these are vaccines that are available. If you are interested in these vaccines, work with the Afri-Exim Bank so that you can deposit your monies there so that you can actually use it in the pool procurement. Our role there is to facilitate the pricing, facilitate the negotiation so that Moderna doesn't deal with one-on-one basis with the countries there. So I think that is how these negotiations happen. So we reach out to countries, but the requests from countries have not been as strong for that particular vaccine as we would have imagined. But again, early days, this is, for the continent has been relying on the AstraZeneca, the Johnson & Johnson and other vaccines to scale up its immunization programs. Capabilities and capacity to roll out -20 and -80 vaccines is another level of challenge. So I'll not be surprised that some of the reason is that countries look at their capability, storage capacity, distribution capacity, and cold chain and said, for now, we don't think we want to go down this route. So I think that could only be the reason. It could be a major reason why they didn't just go through that and exercise that other option.
All right, thank you very much.
Let me just add that which may change as countries get more prepared and with time. We are working together with colleagues from Gavi, UNICEF, and WHO to provide more capabilities for the countries. And who knows, at some point that may change if countries assess that they can actually store vaccines and then distribute them with their cold chain.
Thank you very much, John. I don't see any more questions, but let me just remind, or rather inform colleagues to be on the lookout for the activities to mark the 5th anniversary of the Africa CDC. And these will be happening on the margins of the summit that is currently ongoing. And still on the issue of the summit, colleagues, you are very welcome to accredit if you want to come and report live from Addis Ababa. It is being held in physical format, and that accreditation is still open on the African Union website. That's www.au.int. If you're not able to come, you can also catch up with various press conferences, which would, of course, include something from the Africa CDC, but we will have the leadership of the African Union giving you briefs on the transformational impact of the Union through those press conferences. So please do feel free to contact that website, either to accredit or also to follow on those press briefings. So thank you very much. That is what we have today. Let me just do one last sweep. I see that James Macharia has sent through another question. And he says, Dr. Nkenga Song, would you say that the coronavirus should no longer be categorized as a socially critical illness? And he goes on to say, are you more optimistic about the vaccines and other measures to contain COVID today than you have been since it was declared a pandemic nearly 2 years ago?
I think, James, we are still in the middle of a pandemic. I think, let me answer it that way. I think, which means We are far from getting out of the woods yet with this virus. When I hear people say, well, it looks like we are heading into an endemic situation, and I think it's just a confusing terminology. I think an endemicity in public health is where you reduce the frequency or the prevalence or the burden of the virus to a level that you can manage and live with in the community, and they only occur spontaneously, like the seasonal flu. It's endemic there, but it doesn't mean that it's not killing you. I mean, it kills. Endemic HIV kills. Endemic malaria kills. So we are not yet at that point. I mean, the positivity rate for COVID on the continent is around 11%. So I think it's still very, very high to even think of that we can relax any measures there. I think we need a combination of 4 things to happen. Continue to maintain our safety, physical safety, avoiding large gatherings. Key word here is large gatherings. And make sure we wear masks and maintain social distancing as much as possible. A scale of vaccination, roll out antigen testing, the rapid test as much as possible, and make accessible the treatments that are available. And we are working across all 4 areas. I think we've discussed some of those during this conference. Yeah, so we are the pandemic is far from being declared over, in my view.
All right, thank you. That was our last question for today. So please give us your main headline points for colleagues on the briefing today.
No, absolutely. I think today is the 27th of January. In the next 3 days or so, Africa CDC will be celebrating its 5th anniversary. So what an amazing journey, a journey that we have journeyed with all of you, and with a very significant impact on the continent. And thanks to all of your support, the way that we've worked collaboratively in the last 5 years is just remarkable as we build a new institution. So I really ask that you join us on the 31st of January in celebrating this milestone for Africa CDC. It's a remarkable milestone that we must recognize the vision and the wisdom of our head of states when they decided that it was important to create their own public health agency. They now own the agency, they listen to the agency, and I'm very proud of the leadership of the continent. So join us on the 31st as we celebrate. We will be doing a week-long celebration of this milestone. So please, we urge that you celebrate it with us, you talk about it so that the population can actually be informed that their organization has taken up and is heading in the right direction.
All right, thank you very much, John. Let me add that having been there at the beginning of I do share a lot in the excitement and the pride on the achievements that the agency has achieved since that time. So colleagues, thank you very much. As Dr. John has said, we are now on the 27th of January. It's incredible to believe that we've already gone through the first month of 2022. So let's meet again next month in February on Thursday at the same time. Bye-bye for now.